sharing your story, and for everything you do to help others avoid smoking tobacco and the dangers associated with that. Next, we have with us a good friend of ours, Beverly May. Beverly is the Regional Advocacy Director for the Campaign for Tobacco-Free Kids. That group is a privately funded organization, and they focus the nation's attention on reducing tobacco use, especially among children. Beverly is based in Utah, but she was born and raised right here in Ohio. She provides support and technical assistance to state tobacco control coalitions like ours here in Ohio, and as we advocate for tobacco control programs and policies. She provides testimony to state legislatures on a variety of tobacco control issues and speaks at local national conferences. And she has more than 18 years of experience working in the area of policy change and focusing on anti-tobacco issues, and 25 years of experience with youth, focusing on behavior and substance abuse issues and policy change. So thank you, Beverly, for being with us today.
I want to follow with what Rick had to say and talk a little bit more about other tobacco products. If you don't know, Altria, which is one of the major tobacco companies out there, have bought U.S. tobacco. Now, U.S. tobacco makes other tobacco products. So there's a reason for this, because in 2007, they also bought Middleton Tobacco, which is another other tobacco product. And what is happening with their marketing now is they're talking about, as Rick said, they're not saying it's an alternative to smoking, but their ads will lead you to believe that, you know, where there's non-smoking allowed, you certainly could put this in your mouth and you could, no one would detect it, or if you're on the plane and it showed in ads. So the companies are very wise. They look ahead to what's going on out there, and other tobacco products is something that is being marketed more and more with all the smoke-free laws, and also they're being flavored, let's say cherry, let's say some of these grape flavors are targeted for children. Now they say they're not, but it's hard for me to find, and I've asked a number of men, would you have this grape, tutti frutti chewing tobacco, and they don't seem to be interested in that flavor. From the tobacco documents, we know that they had, meaning the industry, had a graduated way for people to start using other tobacco products. First, they start them with the fruity flavored cherry and not the harshness. And then next, they can graduate up to less fruit, a little bit harsher. And then by the third point, they're really into the heavy-duty, as Rick was sharing, without the flavor. And by that time, they're addicted. And we're facing a program that could be shut down in July. And people should be very concerned about that for a lot of reasons. Even if you're not a smoker, we pay for everyone that smokes. Smoking-related diseases are very expensive. Medicaid is paid by the state, and every family pays approximately $600 to $700 for smoking-related diseases. So we need to look at the funding for tobacco prevention and realize that if we don't have that funding, you're not going to have a media campaign that's going to drive people to a cessation line that's going to help them to quit. If it helps them to quit, it will save money for the state. So that is something very important. We have a couple solutions we'd like to talk about that we feel that would be very helpful. Of course, we think it's the most brilliant idea, and all the legislators should do this. The other tobacco tax in Ohio, which is different than the other 49 states, has not been raised. The price is very, very low. The cigarette tax is up here. So what happens? Someone can't afford the cigarettes, they'll go down to the other tobacco products. We want to see parity, where you have the same price for other tobacco products as you have for cigarette tax. If we're able to do that at this point, it would bring in approximately $53 million. Be raising the cigarette tax. Currently, the tax in the state of Ohio is $1.25. That is very, very low for the other states. We used to be kind of in the middle and even a little bit higher, but we have gone down because cigarette tax are much higher in other states. We propose raising that $1.25. That would bring in $347 million. And what we would like to see is, because of the dire budget situation in the state, that money to be used as ongoing funding for health programs. Now, I'm sure most of you know that there's a Supreme Court case where there's $258 million in the court. Even if that money was released tomorrow, that's one-time money. That is not money that would be sustainable and ongoing. So I'd like to end by saying, really, this would be a win-win-win. It'd be a win for public health, for the public health of the people here in Buckeye State. It would be a win because we would be able to have the voters have their wishes, because all our polling shows that the voters are in favor of this. And also it would be a win because it would be sustainable money that could be used for health programs. The same issues. But what is happening nationally is happening here also. We are definitely seeing the growth in the use of non-cigarette forms of tobacco. You can buy candy-flavored tobacco in its brightly colored packages in convenience stores right here in Ohio. In fact, if you saw my lovely bucket that I created at the check-in counters, all of the tobacco in here was bought here in the state of Ohio. These are cigars. They look like bubblegum cigars that we saw when we were kids. They're not. They're real cigars. I bought these at a United Dairy Farm store here in Ohio for 79 cents a piece. Cheaper than a lot of candy. Bought these at a Speedway in Ohio. This is hookah that we bought, bubblegum flavored. These cigars here were right beside the donuts, away from the view of the cash register. So they're definitely available. They're inexpensive. They're being sold right here in our community. In fact, we're a test market for new products, new kinds of smokeless products right here in Columbus, Ohio. And they're currently test marketing orb strips and sticks, dissolvable tobaccos. They're mint flavored and easily disguised for our kids to use. And it said we're ready to lose our funding, as many states are facing cutbacks in funding. We're ready to lose all of our tobacco prevention and cessation funding as of July 1st. That concludes all of our wonderful community coalitions. Many of you are sitting out here in our audience today that have wonderful coalitions that work in the community providing prevention and cessation to your neighbors and your friends. Many of you are sitting here that used to have community coalitions and no longer have them because your funding has been cut and you can't provide those services, and you know what a need there is in the community. And you can't provide those when you see people going without those and kids starting to smoke, or people that desperately want to quit and they don't have the resources because that money has disappeared. So what we're asking legislators is what Beverly said. Fix those two problems with one simple solution. Equalize the cigarette tax and the other tobacco products tax, and dedicate those funds to tobacco prevention and cessation. We could get those levels of programming back to where it was 2 years ago. Those of you who don't have your coalition and don't have your programs anymore could get those back. Those of you who are looking at losing those programs as of June 30th would not have to worry about that anymore. You could have your money back. We would also see the youth and adult rates drop. We would see youth users of these lovely products in my bucket of shame drop by 25%, overall consumption by 15%. It's a double health win with the programs and with the use of the products. And Beverly talked about the benefits of raising the cigarette tax. Ours hasn't been raised in 5 years. Now we're below the midpoint for states. Raising the tax to $1.25 would reduce youth smoking rates by 17%, and 66,000 Ohio adult smokers would quit. What a benefit to the people of the state of Ohio.